619 now, purple, ropey, varicose veins. Ugh, nobody wants them. Women are more likely to get them. But get this, men make up a quarter varicose vein sufferers out there.
With us now is Dr. Greg Stroup, a surgeon with Providence Medical Group. Dr. Stroup, how are you this morning?
Doing well. How are you?
Good. What causes varicose veins?
Well, varicose veins are dilated veins that occur when blood pools in the legs, and this often happens when the valves in the veins aren't working properly, allowing blood to flow backwards into the veins instead of up through the legs to the rest of the body.
Okay, so we know it's unsightly, nobody wants them, but is it a benign condition or can it be a real health concern?
Well, in general, it's a fairly benign condition, but it can cause some pretty significant symptoms. People can have pain, leg cramps, can really interfere with work and activities, and can be associated with blood clots in the legs as well.
So how do you treat varicose veins?
Well, there are a variety of treatments ranging from exercise, weight loss, elevation of the legs, and compression stockings to try to squeeze the blood out of the legs. And then there, not surprisingly, are a variety of procedures to remove those veins. Some of them are injections. Some of them are small stab incisions to remove veins. And then there are minimally invasive procedures where we use catheters to essentially close off the veins through small incisions.
Do those often work, and are they painful?
Yes and yes. They often work, and those newer procedures that are catheter-based are much less painful. In fact, about 99% of patients report no pain at all. And that's really the trend over the last several years, is to trend away from surgical procedures that remove the veins through multiple little incisions to either injections or catheter-based procedures. And they work very well. The success rates are greater than 90% for most of those procedures, and patients often feel and look much better. Generally
speaking, do insurance companies see this as just cosmetic or a real necessary thing to cover?
It varies. The small little spider veins that people get around the ankles and behind the knees tend to be looked at mostly as cosmetic, and those treatments are almost never covered. Varicose vein problems, especially with appropriate symptoms, are usually covered by insurances, although they typically will require a period of a few months of lifestyle modifications, such as exercise and compression stockings, to prove that those are not going to be appropriate treatment for patients.
All right, Dr. Stroup, thank you.
Thank you very much for having me.
Dr. Greg Stroup, he's a surgeon with Providence Medical Group.